7:30, perfect. All right, well, hello. So welcome to the webinar. My name is Paul Ziemer. I'm just gonna mute everybody. Sorry, Wayne, see buddy, you're muted. So we got Wayne, Donald, Deborah, Audrey, Paul, and Manny. So nice to meet you all. What I wanna walk you through tonight is something that we've been using in practice probably now 4 years easily. And at any time, if you have a question, you want to stop me, just type down in this box down here and ask me a question. I'll definitely unmute you and open the floor to questions in about a half an hour. I like to talk, I like to answer questions, but I'll try to keep it real straightforward. But again, thanks for your time tonight. And if you have any issues, please just type a quick note in here and I can answer them or we can fix it. So we're recording this and away we go. So again, my name is Paul Ziemer. Thanks for being on with us. And what we're going to talk about this evening is photodynamic therapy for the treatment of onychomycosis. So this is a interesting topic because there's been a multitude of options, treatment options for the clinician. And as you can see from my credentials behind my name, I'm a chiropractor. So it really doesn't make any sense that I'm doing this or working on this, but you'll see as we go through it how I came to this. And through the work of some podiatrists, chiropodists, foot care nurses, and with the leadership of Manny Mones, we were able to put something together that is not only scientifically valid, but super effective in clinical practice and super easy. So if it seems super easy by the end of it, it's because it is, and the results are spectacular. And we can take none of the credit for it because all of this information and technology has existed for years. So let's get right onto it. I'll get this thing going. That's me, Dr. Paul, chiropractor. So just to let you know that I'm going to be talking about the Genesis Health Light as the source of light for this this process, this PDT process. And I am involved with that company. We didn't make the light to do this originally by any means. So I'm not getting paid to do this, and I'm not getting paid on any of that kind of stuff. But obviously, I'm a big believer in the light, and I know exactly how it works and what it can do. What's the problem? The problem is that big pharma and your patients and everybody else out there knows that toe fungus is a big problem. It's a cosmetic problem. It's really not dangerous. There's some references to the spores or the from the fungus being dangerous for the heart, things like that, if it got that bad, getting in there. But the bottom line is it's an issue that affects tons of people, and they all seem to be looking for solutions. And so regardless of what kind of practitioner you are, they come to you and they're looking for solutions. And the results have been nothing but disappointing. And I think part of this, as healthcare practitioners, we honestly get to blame the patient. They don't clean their socks, they don't take care of themselves, they don't keep their immune system up, but they come to us and they've got this problem and they want us to fix it. And we get to see them for 15, 20 minutes a week, a month, a year, whatever it is, but they want us to fix them. They want us to fix this problem. And then they also put us in the uncompromising position of recommending products to them. So again, these are all my own thoughts, but it's difficult to spend time vetting out good quality products and then recommending them to the clients. And then if they don't have good results because they don't take care of themselves, they come back and say, well, it didn't work. And you know darn well it works, but they didn't use it right or they didn't follow through. It's just whether they, same thing when it comes to weight loss or it comes to exercise or it comes to sleep. Patients don't seem to do what we want them to do. So that's why I really like the program that we put together here. It works. it's easy to follow, and we don't have to rely on the patient all that much to do that many things. So what are the options for the patients right now? So we've got TV ads going on in Canada, embarrassing men about their toes and the way they'll look when they're all full of fungus, and with some sort of vague, ask your doctor. It's coming from a big pharma. They're going to sell them either some oral medication or topical or something. Talk to a lot of nurses, and they'll say their patients are, using apple cider vinegar or different things like that, Vicks vapor rub, urine, anything that they can use or do to try to kill the fungus, okay? And what they're really looking for is a cosmetic clearing. They're looking for a solution to the way it looks, but they never seem to look at the whole self. They never seem to look at how strong their immune system is. They never seem to look at how well they treat their feet, or they clean their feet, or clean their socks, or even their bedding. So it's really interesting that there are many different, what do you want to call it, sort of old school ways to fix it, new school ways to fix it. And unfortunately, the patients that seem to have it tend to be immunocompromised, so there's limitations to the medications they can use. And lately, in the last 5, 7, 10 years, I guess, the lasers have been a big part of it. So you may own one. You may have worked in a clinic that has one. You may have had patients that have gone there. And for the most part, they haven't been very effective either. They've actually been very ineffective. So leaves a wide open space for patients and for clinicians to come together and look for something new. And that's kind of how it came to us. My background is in lasers and light therapy. And when I first saw lasers being sold to clinicians for toe fungus, I was pretty sure that it didn't do that and it wouldn't work. And we did some research, we found out that it really doesn't. So obviously I'm saying things haven't been that effective. There's lots of opinion leaders, and there's lots of journal articles and research out there that shows. So here's this one, there's some dermatologists and podiatrists came together. They're saying no evidence for laser effectiveness in the literature. There isn't a lot of good studies, but what there is, it wasn't good. Dr. Vender, in the second study I quote here, is a dermatologist. He was asked to do some research into a literature study or literature research to find out what would be the best way to treat a diabetic with toe fungus, and the safest. We are getting a lot. Okay, I'll try to back up a bit. The safest choice was really to use a topical, and we also found that those might have been the safest, but they're not the certainly not the most effective. Saying that, when you have a medical device and that medical device is being sold in Canada, United States, the FDA and Health Canada have to be involved, and they are the ones that are going to tell you what you can or cannot say about your device. It's actually kind of interesting if anyone's been through this process. I've been through it now 3 times with different devices to get these approvals or these clearances. They almost don't care that much about how well it works. They care more about what you say it can do. So they're there to sort of protect the public for sure, but they're really there more to protect you from marketing and false claims than actually effectiveness. And I find that a lot of things that are on the market are not that effective, but they try to limit what they say they can and can't do. And I guess I'm trying to make the argument, the balance between safety and actually bothering to have something on the market that doesn't work well versus just these simple marketing claims. And I think this next slide will clarify what I'm trying to say here. So one of the first, and I don't want to pick on these guys because there's a bunch of other guys like them. One of the first devices that I saw was a Cutera device. Actually happened to be named, their model name is Genesis, same as the Health Light that I work with. But basically they were selling a very expensive laser to clinicians and telling them that, yeah, you're going to make $20,000 extra a month doing this, selling this program to your patients, and here's what it does. And when you go and look up the device classification, it's a little more clear what they've been allowed to say. And all it says is temporary increase of clear nails in patients. Doesn't say it kills the fungus, doesn't say it'll never come back, doesn't say anything. It says the temporary increase of clear nails. And I don't think that's what your patient signed up for. When they pay all this money, and you paid all this money for a laser system, you kind of expect it to kill it, okay? So it was really interesting to me to see how they were marketing different devices. And a lot of people don't take the time to actually go and pull the certificate and see what they're allowed to say. And then when you go back and read the literature or the marketing material, you realize they very carefully word it as to what they're saying. But when you read into it, you realize they make hardly no promises. So again, we know as clinicians, when a patient comes in to see me as a chiropractor, and certainly as a chiropractor, when they come in and they've got back pain or something like that, you can't say, well, I can guarantee you in 5 visits you'll be better, because that's not true. But you have a responsibility to be very, very clear whether you're making a diagnosis or not, if you're allowed to under your certification. But you have a huge responsibility to be able to lay out this prognosis and treatment plan to the patient. And if you said to somebody, I need you to spend a couple $1,000s and I'm going to put my laser on your toe, and the chances we're just going to clear that nail out for a while, they're probably going to say no. So it really wasn't very effective. It's rather unfortunate, and that was the main concern was, why are we not able to find something that can work well for the majority of patients? So let's talk a little bit about lasers, okay, and about light, okay, light therapy in general. There's 2 things that I want you to go away from today and remember in your back pocket whenever anybody's talking about laser therapy, light therapy, low intensity laser therapy, whatever they want to call it. Anytime someone wants to put a light near your body to do something, there's 2 things you need to ask them. What is the wavelength and what is the power? Okay? So as you can imagine, the sun has all the wavelengths available that God's made for us. That's great. The wavelength of the light is going to affect different tissues in different ways, okay? So the wavelength is like the channel on your TV. If you want to watch sports, you got to have the sports channel. You won't find sports on the weather channel, okay? It's just how it works. So different wavelengths of light affect muscle, ligament, tendon, bone, blood, tissues differently, okay? And we know that certain parts of light can give you a tan, other parts of light can create heat. That's all available in the full spectrum. So whenever anyone is wanting you to buy a light or your patient has gone for any kind of light therapy, it's very important that they understand what is the wavelength of light that you're applying to my body, and do you know or will you tell me what tissues you're trying to affect? That's very, very important, okay? The second one is power. It's very, very trendy now, and I make a joke all the time that it's sort of a guy thing, that more power is better, right? So, you reach your midlife crisis and you buy a sports car, and very often you wreck that sports car. You can't handle the power. So more power is not always better. The same goes with light therapy. The body has to bring in this light energy. If you put too much energy into the body, it won't necessarily generate heat, but what it can do is shut down metabolic processes as they are supposed to go normally in the body. So too much power can shut down the natural processes that we want to happen. So class 4 lasers are very, very popular these days. You'll see more and more of them, and the salespeople will try to tell you, hey, ours is a class 4, it's the most powerful. You can get the job done in half the time. Why would you buy, a laser or a light system that, takes 20 minutes to work on the patient? Well, if you're a physiotherapist or a chiropractor, yeah, okay, maybe you want to treat patients quicker. But the human body isn't a car where it's a race to change the tires. You have to put the right amount of energy in at the right pace. So a class 4 laser, especially if you're going to treat plantar fasciitis, Achilles tendonitis, wounds, let's say, talk a little bit about wounds, or using it for this type of fungal approach, you don't need that power. You don't need to pay extra. You're not trying to do it faster. It doesn't take long to do anyhow. So very often, again, when patients have a poor experience with light therapy, and I'm not talking about PDT here where we're using two substances, when they're just talking about light therapy, very often the wavelength was not matched properly to the problem and the power was not matched properly to the problem. So for us tonight, what we want to talk about is photodynamic therapy. Kind of a neat term that means we are going to create some movement, we're going to create some change by using something that is photosensitive, and we are going to stimulate it to do a job for us. So it's kind of, I have teenagers in my house and I find I have to stimulate them to do something. If I don't, they will do nothing, right? So if I want them to shovel the snow today that we had, it's either a bribe or a threat, right? You want to use the car, or I'm going to start yelling, or you not getting your allowance, or whatever it may be. I'm not allowed to turn off the Wi-Fi. That's too drastic. They'll call children's aid on me if I do that. But everything that we are talking about here is going to be stimulated and generate a reaction so that we can have a result. So photodynamic therapy essentially just means that we are going to use a light sensitive compound. So a compound that will react to the light. We're going to expose it to the light, and that compound becomes toxic to targeted cells and microorganisms. So essentially, it involves three key components, and it's really, really this simple. We got a photosensitizer, and in our case, it's methylene blue. So methylene blue, I'll talk a little bit more about it specifically in a minute. We are going to apply the methylene blue to our areas that have fungus, whether it be the nail or the skin. We can apply it to both. We are then going to apply a light source, okay, to that photosensitizer, to the methylene blue, and the reaction is going to be very quick. It isn't going to recreate any heat, isn't going to create any big change in color or anything like that. But we are going to form a toxic oxygen species that is going to kill the targeted cells. So again, I'm talking about killing them, not temporarily making them uncomfortable. I'm not talking about clearing of the nail. We're talking about killing the cell. In this case, it's going to be fungal cells, gram-positive, gram-negative bacteria. So essentially, it's almost like it is a disinfection. We are going to disinfect that area by killing fungus, gram-positive, gram-negative bacteria. Okay. The photosensitizer, and there's a bunch of them, there's many of them, you know, used in different aspects of medicine, and they have been used for a long time. And that's what I was saying is that, you know, when we first started looking at why we were struggling with killing fungus and getting the results that we wanted, I couldn't believe that the knowledge was already there from the 50s, 60s, and 70s on photosensitive species. So we're talking about methylene blue, but I've listed some other examples here that have different actions and affect different bacteria and different things like that. But the photosensitizer has to be specific to what you want to kill, and that's where the methylene blue comes into play. And once we activate it with a light, essentially it goes through go through one or two different types of reactions, but basically it's throwing off an oxygen. Okay, that oxygen is going to be causing damage to cell structures. So we are literally taking a bomb, attaching a detonator to it, setting it off, and killing the cell by destroying the cell wall, by destroying the mitochondria in that cell, so that that cell can't function anymore. So when people ask me, like, how long does this last? You know, will the patient's fungus ever come back? Things like that. I tell them that once you do the treatment, wherever you get the methylene blue to, whatever it's on, and when you stimulate it, you will kill that cell. And that nail will grow out clear, and that's great news. If the patient's still got poor hygiene, a weakened immune system, whatever it may be, you may have to treat them again in a year. I don't know. But you know that you can disinfect that area. You can kill fungus, gram-negative, gram-positive, using this process. And the way it does it, and again, just to reassure you that we're not poisoning the environment around the cell and hoping that those cells aren't active for a while or whatever. No, we're actually lysing, breaking the cell wall and destroying that cell. This is a different way that it can happen, a different type of reaction. And it can affect the DNA, the mitochondria, lysosomes. It's toxic to it all, really. That's what we're trying to say here. Photodynamic therapy. Okay, overall, like I said, it can affect all these different bacteria, fungus, and viruses. And yeah, like I said, MRSA, VRE, HIV. This isn't new to medicine. It isn't new to the dental world. Dentists still use, I believe, methylene blue when they take out big extractions. So, what do you call it? Wisdom teeth, big socket, when they do that surgery left in the jaw, they'll put methylene blue in there to disinfect the area. Some dermatologists, actually quite a few, are using photodynamic therapy on skin cancer. They're applying it right on the skin, using the light to use it to kill those cells right on the skin itself. And so it is. If you look around and you do any kind of a literature search or a Google search, you'll see disinfection processes using this. And again, even in surgery, they used to use methylene blue around the wounds before they made incisions, and they switched over to I guess iodide is more brown solutions because they don't stain as much. The blue is a stain, and I know you've all worked with it before in school, but it's a stain and it can stay there for a little while on the skin for sure. Okay, so just quickly about methylene blue. Again, like I said, you've all used it as a stain to be able to look at cells under the microscope, either in high school or university. And it's not toxic. It is, you could actually drink it. I wouldn't recommend it, but you could drink it. The nice thing about methylene blue is that it is fairly readily available, and it's not toxic or can't really, there's no special handling problems or anything like that you have to worry about in your clinic. So methylene blue, the one that we use is we actually thicken it up a little bit, make it a little bit more like a serum, so it's not so watery, so it'll stick to the nail better. And it's also pharmaceutical grade. It has to be clean, and not just clean because you're applying it to the patients. Even though it's their nail, you want to make sure you do it right. But methylene blue, like these other photosensitizers, have a specific wavelength of light that they absorb. And when they absorb, they become excited, and then they create that oxygen, and then they create that toxicity. So for methylene blue, it's 660 to 670 nanometers is the sweet spot of where it can absorb light. And that light appears to be red. So if you've ever seen a red light with a laser, very common. The 660, 670 is good for muscles also. So it's a more common laser color or wavelength to use, and it comes out as red. Common uses of methylene blue. You can use it to treat cyanide poisoning. I don't really know the mechanism of that. I did know, but I don't remember. And again, that if anyone has fish, they used to put methylene blue in your fish tank to kill a fungus in the fish tank. Don't use the same stuff that you put in your fish tank. It's not clean, or it could have heavy metals in it. It's okay for your fish, not good for your patients. And it's a stain, basically. Genesis Health Light. I'll just talk a little bit about that. So the Genesis Light is, again, something that I've worked on with this company now for probably like 6 or 7 or 8 years, first started to be a light for physiotherapy, chiropractic, soft tissue work, and that was the main thing. It has. I'll show you the wavelengths in a minute. And it just happened that it happens to have the 660, 670 wavelength. That's why it's a perfect fit here. It's also not very expensive. It's around $2,000. So for a practitioner, the return on investment in that is pretty good. It's not something that's expensive, but it'll do the trick for what we need it to do here. It has the power and it has the wavelength to do that. A lot of our foot care specialists are using Genesis Light for plantar fasciitis, Achilles tendonitis, that kind of thing also. But it is the perfect light source for photodynamic therapy. Genesis is really interesting too. Its patents actually all revolve around its filter. So as I was mentioning before, and I think I'll show you the next slide or next 2 slides, we want to filter out the UV light, obviously, because that's the damaging rays of light that we don't want those going on our skin. And we want to filter out the far infrared because those ones will generate heat. So we don't want to generate any heat, which we're not, and we don't want any UV. So the Genesis light has a full spectrum bulb in there, and then in front of it is a filter, and that filter is specifically set to give us the broad spectrum of light that we want, while at the same time it filters out the stuff that we don't want. So generally speaking, when it comes to using the Genesis Health Light on human tissue, essentially the light goes on, the filter filters out the bad stuff. That light goes into the tissue 3 to 4 centimeters deep, and what it does is it will stimulate the mitochondria in those cells, the soft tissue cells, to create more energy. And when they're more active and create more energy, they're going to help heal wounds. They're going to help repair tissue. So what it does is a very, very nice booster to the normal healing process. So I'll give you an example. Most likely, I would say we run it about 50% faster for helping people heal from soft tissue injuries using this light. So it doesn't block the pain and, just an instant pain reliever. It just gets whether there's actual skin abrasions, pulled muscles, swelling, all the normal processes that you have to go through to heal. It just helps you get through them faster. And when it comes to wounds and wounds that are stalled and aren't turning over, the light works very, very well for that. And again, there's a lot of research showing how well light therapy works for wounds. What hasn't been accounted for a lot of times is the power and the wavelength, as I mentioned before. And so it's a very, very, very effective product. In this case today, what we're talking about, it really is just acting as the trigger for the photodynamic therapy bomb that we're going to be using to blow up these fungal cells. Genesis, there's the wavelength between 550 and 1400. And I just gave you some examples of different tissues and what wavelength of light affects them best. And that's why if you had a patient that went for laser therapy at a physio or chiro or some other type of doctor, and they said, that didn't really work for me, it'd be really interesting to know what the wavelength of light was that they got treated with and what the power was. I liken it to, if you need a hammer and all you got is a screwdriver, sometimes you can't get the job done. You just can't get it done. So you've really got to use the right tool. This is a spectrograph. This is part of our FDA clearance. We had to prove exactly what we were putting out. And so you can see between 600 and 1400, 1400 is pretty low, the energy output, but able to affect a lot of different tissues: skin, connective tissue, muscle, spinal cord, blood, and nerves. So it's a quite a variable light. It can treat a lot of different things. All right, so now into the meat and potatoes of how we're going to do this, and this is again very simple. This won't take me long to explain. So I'm not the foot care expert by any means. I know this stuff, but I don't know what you guys know as far as getting the job done with the actual tools. So first thing we want to do is debride the nail and cover around the tissue with paper towel. So right away, however you do it, with the drill, not a drill, whatever you got, equipment-wise, you want to bring that nail down as much as possible, get as close, because we want to be able to get the methylene blue into the nail bed, into the nail, into the skin around the nail where it's probably hiding in there. And you can put it right on the skin, the methylene blue and all that, and still kill all that stuff. You're going to apply 1 to 2 drops of those 1% methylene blue. Again, don't use the stuff from the drugstore, from the fish store, the pet store. It's not clean. You can't use that. Use our serum. Manny will fix you up with that. And you let it sit for 30 seconds, okay? So remember, it's a stain. It's going to stain it, right? And that's okay. You don't need to let it sit longer. 30 seconds is fine. The serum that we have is fairly sticky, so it's not runny. You might want to wrap some paper towel just around the toe, but it doesn't run all over everywhere, but it will stain your fingers and it will stain your clothes. So make sure, you know, wear your lab coat. You don't need to wear gloves or anything like that, but it is a stain. Then, based on what, you know, all the literature says for what kind of energy it takes to stimulate methylene blue, we recommend that you use the Genesis Light on high for 4 minutes. We calculated it takes about 3 minutes and 10 seconds to do this, but we just say 4 minutes. So you could do one toe, the big toe by itself, and then do 2 toes together, but you're looking at 4 minutes. Once the 4 minutes is gone by, it's over, okay? So I'll be really clear that it doesn't continue on all day. The methylene blue doesn't continue to work. Once you stimulate it, it's done. So after 4 minutes, it's done. You can then take some alcohol or neutralizer. We've got some neutralizing solution, and clean off the toe. Get as much of the blue off as you possibly can, okay? Because guys don't care, but most women don't want to walk around blue toes for a week or so. But I want to be really, really clear. It's an all or none reaction. So once we stimulate it and it happens and it's over, okay? So people then will say, what is the protocol? When do I get to see them again? You want to give that nail a chance to grow a bit. So you know better than I do your patients, and you know whether they're elderly or their nails grow slow or they're not well. You could see them in 2 weeks, you could see them in 3 weeks, and you would do the same thing again, okay? So whatever you've got the methylene blue on and you irradiate it with the light, it's done, it's dead. You can wait 2 weeks, you can wait 3 weeks, you can wait 4 weeks. I wouldn't. We recommend you wait no more than 3 weeks, and then you do it again, and you're looking at anywhere from 3 to 4 treatments, and that's it. Obviously, you want to have good aftercare. You want to have the % products. You want to have the ability to have the patient to put these products on their shoes or their socks, on their skin, or they go to bed, to help improve the environment around. But what you've done is what you've done. You've killed it. It's over. Repeat in 3 weeks. When you go to put the methylene blue on the second time, okay, for the second visit, it will only stain dark blue where there's still fungus left over, okay? It will not stain dark blue where there isn't any. So that kind of helps guide you to see, and you're going to see a big change from visit 1 to visit 2. But you also want to make sure that as the nail grows and the nail bed and all that, you're getting what you need to get, okay? Yeah, 3 to 4 treatment cycles is all you should really need. And you're just going to follow the same protocol. It's very, very, very simple, really simple. Show you some pictures. I think some of them are here. Okay, here's a better one, yeah. First person, then we put the stain on, then we put the light on. Again, depending on where you live and how easy it is to get it tested, you know, there could be a differential diagnosis, of course, psoriatic nails or whatever, but you can send away clippings to get tested. Most people don't, and the reason they don't is that you can't hurt anyone by doing this treatment. if you look at it, you have some clinical experience, you can say, you know what, it looks like fungus. Seems like it's probably going to be fungus. Let's treat you. After you treat them, they come back for the second visit. If it's cleared up significantly, you know it was fungus. If it hasn't changed at all, there's a problem. Okay. And then afterwards, cleared up. Here's okay. This one's a little better. 3 weeks. Third. So again, this one, you know, took, for example, 15 weeks, but they're spread out quite a bit. And you don't have to spread them out that much. Okay. Like I said, you could do, if you can book the patient, like, you know, in 2 weeks, and then in 3 weeks, and then another 3 weeks, letting that nail grow out, you could do it that quick. It all depends on, you know, obviously getting them back in and what they need to do. But I think that the key is that you're actually going to kill that, and you're just waiting for some growth to come, and you're waiting to see, were you able to penetrate and get it all in there? Let that guy cleaned up a little bit. T2, that's up their final. Here. First stain. I think this patient comes again on the next page. We'll start on 28. Pretty good after 3 treatments. Here we go, another one, 10 weeks, 11 weeks, second. So look, this one took even, after 1 month, it looked pretty darn good. It took 8 months, but only 5 treatments. So it's going to be your clinical call as to how often you want to see them. This one looks pretty bad to me, but it took a long time for that nail to grow. Contraindications. So again, using the light, like any light, they've got to give some basic contraindications. So again, you're not going to treat anybody you think has got cancer around the nail or in the toe. Kidney disease and failure, again, you just don't treat those people. Light's not going to affect it. Pregnancy, you're certainly not going to treat anybody over their belly, but you just, you don't treat anybody who's pregnant. The one that could come across your way, or two, I guess the last two, is any joints, in the toes or whatever that have been injected with steroids or anti-inflammatories. The light could cause those to flare up, make it feel worse. And tattoos. Again, I don't know how many people have their toes tattooed. I don't know, there's got to be a joke in there somewhere, but tattoo, the ink in the skin, if you're using the light, any kind of laser, it'll heat up the ink and it'll give them some pain. So don't do that unless you don't like them. Okay. Exposure time, 3 to 4 minutes. You can treat a lot of people. Also, I believe no matter where you live, this is not a regulated act, so you could definitely designate this to your staff if you have staff. Certainly, if you're the clinic owner or the the clinician, you would want to do the initial exam and consultation with the patient. I don't know if you need to make a diagnosis or not. I guess you could, but essentially, it's non-invasive. It's simple to do, and it's from a revenue standpoint, it's very inexpensive to do, and people have been spending a lot of money. It's a big industry to try to get this fixed. And so I would recommend that you sell it in packages. You want patients to come back. You want them to get the care. You don't want to treat them once. So some of our most successful practitioners, and we've probably got, I don't know, 200 of them. They sell a package where it's like 4 treatments, X amount of dollars. And the patient has to sign up for all 4. And you just tell them, I need to see it 4 times. If you pay for it, then I know you're going to show up. You're committed and you're going to get better. 1 or 2, probably isn't going to do it. So however you need to package that, or based on what your time is worth and what it costs. But the nice thing about it is that your actual cost of goods for the light and the methylene blue is very low. It's a low barrier to you being able to start doing it, and that's really important. All right, benefits. Easy to follow. I hope I made it clear. It's super easy to follow. Fast exposure treatment time. Doesn't hurt at all. It's going to be cost effective for you and the patient. It's non-toxic, no side effects, super high success rate. Really enjoy getting the feedback from the practitioners telling us how great it works. And again, for me, the reason we started doing this was I was sure that laser didn't work, and it doesn't. And just by some luck and doing literature search and looking around, finding this, now I'm excited because it allows all practitioners to be able to offer this in their practice. And the patients that need it, whether they be older or not very healthy, because it tends to show up more in diabetics, things like that, to be able to give them a solution for something that is not going to bankrupt them and the results can be seen fairly quickly, makes me happy that we're able to do that. We do have a website where we list a lot of our practitioners. We can add you to that if you want to be on that. I got to get it updated, but it should be updating today. And that's my info right there. So if you have any questions or you want to get in touch with me, please feel free to. It really is that simple. I guess that's, I keep saying the same thing, but I know that we have had great results with a lot of practitioners, and it is that simple to do. It is that easy to do, and it is very, very, very effective. So if you have a question or anything's on your mind, you can type it to me in the bottom there, or I can even unmute you if you want. But thanks for paying attention. And photodynamic therapy, if you look around, they're using it now for breast cancer with different photodynamic compounds. It's a nice way to trigger a chemical, essentially, that will become active and do targeted disinfection or killing that will save a lot of grief for the patient. So I think you're going to see more and more and more of this, especially as we find out how different sources of light can stimulate these different compounds. So keep your eyes open for that. But if you have any questions or anything at all, any comments or anything you want me to go over again, just let me know. Type it in there, and if I'll wait a minute, we'll go from there. All right, so let's see what we got here. I got a question here. I'm going to go back and read it. How do you clinically approach the situation when all 10 toes involved? Do you treat all 10 at each visit? And with the contraindication of tissue injections, is that specific to the feet or generally? Good question. So contraindications I'll do first. That would just be to the feet. So if someone got a cortisone shot in their shoulder and you're treating their toes, doesn't travel, it's not going to bother them. So unless they've had a steroid or something in their big toe or around there, that's the only reason why you wouldn't use the light. And yes, I would treat all 10 toes. So I would do the big toe by itself, and then I would do the rest of the toes 2 at a time. So you'd be looking at, 4 minutes, 4 minutes, 4 minutes, 12 minutes a foot. So yeah, if they had all 10 toes and both feet, you'd be looking at 24 minutes of treating them. Yes, I would. Because you want to get everything that's involved in the right away solved, for sure. I would treat all 10. And we've seen people with fingernails too, all 10 toes and fingernails infected. We've treated all their fingernails and everything too. So, and like I said, you'll get the skin around there that way too. So, yeah, okay. So again, feel free. You've got my email. You can drop me an email anytime. Specific questions about programming or whatever, you can direct to Manny. But I really, really appreciate you spending some time with us tonight. And wish you all the best. And be in touch. We'll talk soon.